Hi, everybody. Thanks for being patient. My name is Dr. Michael Wald, and welcome to the next installment of my master's program of nutrition and natural health that is posted up on prnfm.com and also on my website at drmichaelwald.com. If you want to go to the Zoom PowerPoint presentations like this one that I've done before, there are approximately 7 or 8 hours worth of them on absolutely essential topics that I think just practically everyone would appreciate. So you can find those, again, as I said, drmichaelwald.com under the blog section. Just click on the title that you want. And for those of you who want to contact me at any point after this talk, that you may have questions or maybe some show topic ideas, I welcome those. Please email those to me at info@blooddetective.com. That's info@blooddetective.com. And if you want to become a patient of mine, either in person or at a distance, I prefer phone calls for those inquiries to 914-552-1442. So today is a very, very exciting topic, and it is about your brain, specifically about how to protect your brain. And if you or someone else you know has a central nervous system or brain injury, then this is definitely the topic for them. The original title of this talk was neuroplasticity. Don't be intimidated by the word neuroplasticity. It simply means that the brain is very plastic, it's very malleable, and given the right conditions, given the right nutrition, given the right therapies, there is a chance that the brain, or at least specific aspects of it, can be regenerated. Now, this talk and these exact slides I presented for healthcare professionals, both medical doctors, doctors of chiropractic, dietitians, nutritionists, all different types of healthcare providers. And I've decided to actually give you the exact talk because all of the medical references, all the scientific references for some of the claims that I make are in this talk. These slides are complicated, but don't worry too much about that because I'm going to summarize each of the slides that are important as we move through this. Okay, so let's just get into it. To begin with, I have to read you this disclaimer, or basically paraphrase it. The information that you'll be hearing today is for educational purposes only. It's not meant to substitute for sound medical and/or natural health advice. So the use or misuse of this information is all about you, meaning that you are responsible for its use or misuse. So don't misuse it. Now, a little bit about me. Once again, my name is Dr. Michael Wald. I have a chiropractic degree, and I have a medical diploma. I have a master's degree in nutrition. I won't name all of these things, but I'm double board certified in nutrition. I practice acupuncture as well in certain states. And basically, my role for my patients is to give them comprehensive health suggestions in the form of foods, exercise, stress reduction, perhaps nutritional supplements. I provide all manner of laboratory testing as well. So what are you looking at here? What you're looking at basically are wires. And I put this visual up here to impress upon you that your brain is basically a bunch of wires. That's the way you can think about it. And the wires in the brain are called neurons. And when neurons are damaged, either from so-called normal aging or degenerative disease, maybe during seizures or toxic exposures like lead, and many, many other causes, these wires break down. And to a certain point, they may be regenerated. That's the neuroplasticity part I was talking about. Again, that word simply means that the brain has some ability to come back. And most of us know this because you've heard of a stroke victim, for example, that have had a stroke and they couldn't speak and their face was droopy and they couldn't walk, maybe they couldn't control their arm or leg. And then after a while through physical therapy, rehab, and time, many people can recover at least some, if not all, of their issues. But I've found over the last 30 plus years that I've been in natural health that there are many times that physicians in the traditional medical field do not know the proper time to intervene for these individuals, and they lose precious time and precious function, perhaps for the rest of their lives. So this presentation is about things that you can do during brain injury of different types. Also, things that you can do that can help offset our risk that's inherent in this toxic society that we're living in for neurodegeneration. Again, another fancy term for the degeneration of the brain and its neurons. We want to regenerate more than we degenerate, okay? We got to keep these wires healthy. Because, you know, we all want to live happy and healthy lives. And the thing with neurodegeneration is that neurodegeneration can be a very slow process, a very insidious process, where one day you're seemingly fine, but then suddenly symptoms and issues of neurodegeneration can happen. Maybe you don't remember things that you normally would. You find yourself just once too often in a room wondering what you're there to do. Or if other people have said to you, there's something not right with your memory or how you're behaving, and you just can't get a grip. These may be signs of neurodegeneration. They may be early dementia or Alzheimer's dementia symptoms or some other type of brain degeneration. And this is just a picture of an MRI of the brain, and these different colored arrows are pointing to areas in the brain, specific areas that control certain parts of the brain and therefore the body. And when there's degeneration in different areas of the brain, depending upon the area, that will determine what part of the body is affected. So for example, if you had a problem with, let's say, neurodegeneration from, let's say, a stroke in the middle of your brain, you might have issues with your feet. And if your neurodegeneration is on the right side, your problem with your foot would be on the left, on the other side of the body. So the point made here is that anywhere in the brain or brainstem or the rest of the nervous system, for example, there's the central nervous system, the center of us, and the peripheral nerves, which go to the outside. Anywhere along those pathways, you can have neurodegeneration. The good news, however, is that we know a lot about neuroplasticity, the rebuilding and the reformation of neurons in the brain. And it was once thought that once these neurons died, you couldn't do anything about them. But we know better now. So as I mentioned, this is a slightly more technical term for neurodegeneration. Again, why am I giving you these technical charts? Because time and time again, I have patients say to me, Dr. Wald, you know, I spoke with my doctor about what you said about neuroplasticity, and he didn't know what I was talking about. And the patient didn't know enough to say anything. Now you don't have to. You can simply direct them to my website, to the blog section, and look up these PowerPoint presentations. You know, oftentimes doctors, when they don't know something, they'll critique it in a negative way. And there's no room for that sort of bias when it comes to people's lives. So that's why I decided to present more technical presentations so that your doctors can see this, so I can work with them to help you. So let me read you a little bit about this. So neuroplasticity is an umbrella term. That means a term that refers to the whole brain, and it's multifaceted physiological processes. And basically, as I said, if you have good neuroplasticity, that means your brain has a great capacity to repair. And if you have health problems that involve the nervous system, that would indicate that your brain and nervous system are not repairing as fast as the degeneration. That's when specific, personalized nutritional therapies are indicated. Again, here are more pictures of the brain. These are MRI pictures. Just to remind you, by the way, MRIs are not radiation like CT and X-rays. And these different colored areas of the brain are just showing the different types of neurodegeneration. And this is a patient with Parkinson's disease, which is what they call a motor neuron disease. That just means that the person's going to have problems walking. Their mental functioning is actually fine, which is actually sad because they cannot control their bodies. And they get what's known as masked faces, or the face can be very blank looking. They take these tiny little steps. It's called steppage gait. They may have what's called a pill rolling tremor, where the hand goes like this, because of these specific areas of the brain. And there's a whole bunch of studies that show that you can focus nutrition on these areas and help these patients. Now, this is a very important chart right here, because what you're looking at here on the left are a bunch of problems that can affect the nervous system. So let me read you just a couple of those. The first one is age and degenerative changes. So as you age, even if you age normally, certain areas of the brain degenerate. And it really is just some luck of the draw if you reach an old age and do not have some mental decline. So again, the sooner you start nutritional natural therapies, the better able your nervous system will be to offset these problems. Next, Alzheimer is a disease of the nervous system. When the brain doesn't get enough oxygen, that's known as cerebral hypoperfusion, not enough blood supply and therefore oxygen. We can have cognitive, learning, and memory issues. All of those different things can show up when there's neurodegeneration. You might have motor problems and movement issues. That's what motor is. You might have sensory problems like pins and needle feelings or numbness or chronic pain. All these things are nervous system. All these things have the potential of being helped through proper nutritional and natural therapies. Stroke, obviously, as I mentioned before, due to ischemia, a lack of blood supply to the brain. Depending on the area of the brain, that'll give you your symptoms. Multiple sclerosis, where they have demyelination of the white matter, demyelination of the gray matter as well. And all sorts of neuropathic pain syndromes. Certain people might have problems with neurotransmitters. Someone might have a physical injury like a car accident to their brain or hit their head somehow. And others that have the type of brain dysfunction known as minimal brain dysfunction, where there are all these sorts of problems showing up, and it's called minimal brain dysfunction. And on the right side of this page, what you see is just some general things that might help when I work on a person's nervous system. I might look at a ketogenic diet. Don't worry if you don't know what that is. We're going to talk about it soon. The caloric restriction, when it is done right, can really help neuroplastic effects in a positive way. The use of nutritional supplements other than medium-chain triglycerides like acetyl L-carnitine or turmeric, for example, or resveratrol, GABA, and many others that I'm going to review today have all shown in good studies to help neuroplastic effects and repair. Various toxins, of course, are an issue, so the nutrients can be focused towards the specific toxins in mind. You know, if someone says to you, yeah, I heard that you should detox with neurological problems and for brain health, so just do a detox. Well, what detox are we talking about? That would depend on the toxin or toxins we're concerned with. So if it's mercury, well, there's a specific way you detox that. If it's lead, there's another way you detox that. If it's estrogen metabolites, you detox that differently. If it's inflammatory mediators from an infection, you detox those differently. So this silliness about, you know, detoxing is good and then not talking about what kind of detox is nothing short of ridiculous. And then there's hormonal effects. Hormonal declines as we grow older, depending on the individual and their susceptibility, can cause all sorts of problems in the brain. Neurons, those nerve wires, can become thin, abnormally shaped. They don't secrete their neurotransmitters as well, which means they don't allow, depending on the nerves, proper motion, proper sensation, proper thinking, and all of that. Hyperbaric oxygen. This is extremely underutilized in medicine for reasons I don't know. Many studies have shown that in stroke victims, for example, which is just one example of a neurodegenerative condition, hyperbaric therapy done as soon as possible can help mitigate or lessen the long-term effects of stroke. You'd think something like that would be used in mainstream on a routine basis, but it's not. But no matter how well or how quickly you administer hyperbaric therapies, you always, in my opinion, want to include nutrition, because you cannot heal the brain without the proper nutrition, at least not in the long term. So we want to focus on hormonal issues as well. As I mentioned, exercise, we'll see soon, has a positive effect on neurologic repair. And of course, mitigating or lowering stress. Stress and stress hormones and the stress response all are associated with degenerative changes in the brain and the rest of the body. So these are some more what I call neuroplastic considerations, just things to think about that are happening when the brain is degenerating. There's inflammation, what's known as oxidative stress. There's lack of plasticity of the brain, where there's hardness of tissue. So a hardened, let's say, nerve won't propagate or allow a nerve impulse to go along in getting to the next nerve. And then different genes in the brain are turned on and off with inflammation and with nutrition. You want to turn these positive genes on that support neurologic repair, and you want to turn off the inflammatory negative cascade or events that happen sometimes with neurodegeneration. I should say happen all the time with neurodegeneration. There's inflammation involved. And then there's the mitochondria. That's an area in the brain and other areas of the body, which it's called the powerhouse of the cell, if you remember that from 8th grade science class. So problems with the mitochondria, they degenerate, there's fewer of them, they start to shrivel, and that's associated with all kinds of neurologic defects. So is everyone following me now with all these different words? I'm hoping that you are. I think that you are. Blood sugar problems, blood flow problems, excitotoxicity, which simply means that there are inflammatory mediators that hyperexcite and degenerate nerves, which generally happen when the brain is injured. So we want to improve that repair of the brain so we don't have these excitatory degenerative chemicals being formed. Okay, let's go to the next slide. So what we have here is just an example of how a nutrient like dietary curcumin counteracts the outcome of traumatic brain injury on oxidative stress. So what does that mean? That means that they actually injured the brains of animals, but they gave them curcumin before they injured them. And when they compared them to animals they didn't injure, those that got the curcumin repaired much better. And that was because it lowered curcumin oxidative stress, which improved the cognition and memory of these animals. So regardless of what you might think about the animal studies, they do tend to show similar changes in human beings. And how much curcumin should you take? When should you take it? What is the type? We'll talk about that in a moment. And again, this is just another brain. It's a cross-section MRI, magnetic resonance image of the brain pointing to an area of degeneration. So once again, we want to see if we see these changes, then we do the right nutritional therapies, or maybe we do hyperbaric therapy, we reduce stress, we introduce exercise. We want to see that the areas in the brain respond. Not only should they respond on imaging like an MRI, but the person should be aware of these improvements, or at least people around them. Now, this chart here shows or explains the value of ketone bodies. So ketone bodies, there are a few of them. Here's 2 of them are known, beta hydroxybutyrate and acetoacetate. And what these ketone bodies are is that they're compounds that allow the nervous system to repair. They're some of the most well-studied nutrients for brain repair. And you would get them in the right form of medium chain triglycerides, or MCTs. Medium chain triglycerides are the ingredient in coconut oil that everyone's excited about, even though no one knows that's why. In other words, everyone seems to be eating coconut oil. And I think for the most part, that's probably a good move. But coconut oil is about 25% MCTs. And if you've got some neurologic issues, you want 100% MCTs. And that's the only thing I give to my patients, and specific types of MCTs. They're not all the same. So basically, if I'm going to read you the last part of this, that these ketone bodies can be elevated with starvation or caloric restriction, intense high-intensity exercise, and a low-carbohydrate diet. All of these different things reduce inflammation in the brain and nervous system and help repair. And listen to this. So here's an example of vitamin E's effect on lead-induced impairments of the hippocampal region of the brain. So you don't have to know what the hippocampus is, just think of the brain. So what happens is if you give someone the appropriate amount of vitamin E, or vitamin C for that matter, and then you give them an amount of lead that degenerated other animals' brains, you can prevent the degeneration to a point if you pre-treat the person with the right form of vitamin E. So it says here that co-administration of vitamin E with lead exposure inhibited the lead-induced degenerative effects in the brain. Super important, and not just lead. This is also true of all the other heavy metals and toxins such as arsenic. Let's move on. Now, vitamin D. Effects of vitamin D supplementation on neuroplasticity in older adults. This was a double-blind, placebo-controlled, randomized trial. It's one of the best study designs you can get. Vitamin D improved muscle function, it reduced falls in older people, and it strengthened their neuroconnections. It made them closer together and more numerous. Vitamin D treatment alone was associated with a decrease in corticospinal excitability. Corticospinal excitability is a bad thing. So anything that reduces it, like vitamin D, is good. Now, not just any vitamin D. So for those of you that have gone to your doctor's done the vitamin D test, and you ask the result, and the doctor says it's low, and you say, well, what do I do? And I hear this every day. And the doctor says, well, take some vitamin D. Wrong, 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 bordering on malpractice. No, if you are below 30 in terms of your level of vitamin D on a blood test, you generally are supposed to take 50,000 units of vitamin D every single week for about 8 weeks. And then at the end of that time, you recheck your vitamin D3, and then you take whatever amounts you need to titrate and tailor your vitamin D so that the vitamin D level gets to a 70. No, not a 50, but a 70. Double-blind studies of a meta-analysis type, those are the best studies. They tell you that the higher normal your vitamin D3, the lower your risk of dying of anything, the lower your morbidity and mortality as vitamin D levels go up. This is another example, I mentioned it earlier, of how vitamin C reverses the neurotoxic lead-induced deficits in certain area of the brain in rats. So just like vitamin E that help mitigate or lessen the degenerative changes in the brain from lead, vitamin C also does that from lead. Ubiquinone, what is that? Well, ubiquinone is also called CoQ10. And ubiquinone is a special form of CoQ10. It's 8 times more absorbable than ubiquinol. Okay, so ubiquinone comes from the word ubiquitous, which means everywhere. So every cell requires ubiquinone. And the areas of the body that have the greatest number of mitochondria, which are energy powerhouses of the body, require the most amounts. And guess what organ or organ system is that? That would be the central and peripheral nervous system. The central nervous system going down in the middle, and the peripheral nervous system that goes to all the different organs. So listen to this. Parkinson's disease is the second most common neurodegenerative condition, and it affects approximately 1% of the population older than 50. That may not sound like a lot, but that is a lot. And what's so amazing about CoQ10 is with Parkinson's disease, CoQ10 is able to attenuate the toxic effects of a toxic chemical on the brain called NPTP. And this is still not mainstream medical care. Why? Well, the main reason is because doctors are ignorant in the areas of nutrition. I don't blame them. Based on some estimates I've read, the average physician receives only 27 hours of nutritional courses during all the years of medical school, so it's extremely minor. So when you ask your doctor a nutrition question and they say that it's nonsense, that's because they actually think, as silly as it sounds, that if they didn't learn it in medical school, it could not be true. And nothing could be further from the truth. So, you know, I take this stuff very, very seriously. When I think of my patients, I think of their lives. I think of the quality of their lives, the fact that they might have kids, or they may have grandchildren, or they can no longer, remember significant events of their lives. And many of these people know that they're losing their mental functions or their motor functions, their ability to ambulate and to walk around, and their power and their reflexes. And I'm so lucky to enjoy a high quality life. I strive to make this happen for my patients. So I do the very same things I would ask of you. I take my nutrients every day. I pay attention to my diet, my exercise, my stress, and some of the ways that we'll be talking about as we move along. Let's talk for a moment just about seizures. Even if you don't have an interest in seizures, basically what this is emphasizing here is that every time a seizure happens in the brain of an individual, there is more and more and more degenerative changes happening. So let me read this little bullet here. An insult to the brain, such as just one single seizure, causes excitotoxicity, that's a bad thing, neuroinflammation, another bad thing, and production of reactive oxygen or nitrogen species. All of that is bad degenerative news. So if you improve the antioxidant abilities in the nervous system to repair, you can offset these issues. The studies have been done. I have found almost no neurologists that are seemingly aware of this. They know that all these chemicals are produced in the degenerative brain, but if you ask them about, taking antioxidants, they look at you as like you're a deer in the headlights. Ignorance is bliss. Not funny. And this is another study and that says that medium chain triglycerides, which you can get from coconut oil, or pure MCT oil, is a major treatment of drug-resistant epilepsy, but is problematic because it's very difficult to stay on a ketogenic diet. For those of you who do not know what a ketogenic diet is, basically it means a diet that's high in proteins, generally animal proteins, and fats, which produce lots of ketones. Now that sounds good on one level, but it increases the risk of all kinds of diseases on the other hand. One does not have to do the traditional ketogenic diet. Like I see on some of these Facebook pages, people are bragging about all the weight they lost because they're eating bacon every morning. That is ridiculous, and the level of ignorance there is quite sad. That's why I do not insult your intelligence with these presentations. I give you all the big words. And what I have found, again, over my 3 decades or so in clinical nutrition practice, is it is not necessary for people to be on a ketogenic diet to raise ketone levels. The right nutritional supplements can do that. And I'm not the only one that thinks that. There are other persons involved in research that have found the very same thing that I have. Now let's talk about fruits and vegetables in a general sense right now. So to begin with, we know that in fruits and vegetables, we have a compound known as resveratrol. And most of you might be somewhat familiar with resveratrol because it's in wine, particularly red wine. And sadly, no, you're not going to get therapeutic doses of red wine to help your brain or nervous system in any way by drinking alcohol. But you can take nutritional supplements. So in studies, resveratrol reverses the synaptic plastic defects in areas of the brain that were starved of blood supply. So that is a major, major finding. Once again, you will be hard-pressed to find any neurologists, which are supposedly nerve specialists. Chiropractors, though, seem to have some knowledge in this area. So number one, let's jump to dementia, which is the most prevalent neurologic disease in aged individuals. And it involves chronic, what's called cerebral hypoperfusion. That just means there's not enough blood supply perfusing the brain. So if there's hypoperfusion, there's not enough nutrition, everything dies off. But if you induce that in animals, but first you pre-treat them by giving them resveratrol, you can effectively restore the plasticity effects, which helps to restore function. Amazing. And this one right here, very, very important, novel application of brain-targeting polyphenol compounds in sleep deprivation-induced cognitive dysfunction. Woo! What does that mean? Okay, all that means is when you keep the animal up at night, and that could be a human being as well, and you keep affecting negatively their sleep, what happens is the brain starts to decay. It starts to physically atrophy. Neurons get weaker. Their connections get looser. There's more inflammation, oxidative stress, right? This all makes sense now. You actually understand that, right? And you lose cognitive function. Now, what this study showed was that bioactive dietary polyphenol preparations, this was a pre-made polyphenol preparation of concentrates of fruits and vegetables. And that contained, among other polyphenols, ingredients like grapeseed extract, Concord grape juice, resveratrol. All of these different things targeted all these inflammatory degenerative chemicals in the brain and allowed a restoration of function. On my Blood Detective website, where I sell my own brand of supplements, blooddetective.com, you might want to read the details of my superfoods formula 1, 2, 3, and 4. So superfoods formula 1, 2, 3, and 4. There's a green formula, a red one, an orange, and a purple. I generally start all my patients on a half a scoop of all of those mixed together at once in the same cup, diluted with about 10 to 15 ounces of water, and they drink it every day. you'll get the concentrated equivalent of over 72 pieces of fruits and vegetables. I am not saying that you should eat this stuff or drink this stuff in place of fruits and vegetables, but there is no way that eating can even approach the levels of these compounds, which is why they use these pre-made preparations of superfoods in these studies. Very important, the polyphenols. And here, I'm going to read this title to you. A diet enriched with plant sterols, I'll tell you what those are in a minute, prevents the memory impairment induced by cholesterol loss in the brain. So when you age or age badly, or when you take cholesterol-lowering medications like statins, you actually reduce not only the cholesterol in your bloodstream, but you reduce the cholesterol in the membranes of the cells of the brain. That is not a good thing. That's been associated with depression. That's been associated with increased risk of suicide and also memory impairment. But there is a plant product known as plant sterols, and they've been shown to mitigate or lessen these degenerative effects. So let me read you a little bit. So cholesterol reduction in the plasma membranes of the brain cells. So if you have a brain cell that's a circle, the membranes out here are partially made of cholesterol. If you reduce the cholesterol in this, it's going to become kind of weak and it's going to deform and it's not going to work well, and things that are supposed to get in and out don't work quite well. That's the degeneration happening there. But if you have a plant sterol enriched diet, you can reduce these age-related declines in cholesterol in the brain. So again, you can check out and read the details, plus the scientific references that I have on blooddetective.com. You can also look at my regular website, which is drmichaelwald.com. Go into the blog section, and you can just scroll down, and those are all the different radio shows that I've done. If there's any other topics that you want to hear, I've got tons of free content on the site. Just go to drmichaelwald.com and go on the homepage, and there's a search bar. Just put it in there and type. If you have a specific question for me, you can't find something, do not call me. Only email, that would be great. That would be info@blooddetective.com. You can call me, though, if you want to become a patient. So here's another nutrient that's very important for neuroplasticity repair, the use of L-carnitine. So L-carnitine is an amino acid, and acetyl L-carnitine is a particularly active form of L-carnitine. So it says here that L-carnitine restores synaptic transmission. And what that means is that the nerve cells are like this, and they go together, okay, there's a bunch of nerve cells, and they have tiny little spaces between them. That's known as a synapse. And the nerve here makes neurotransmitters in this space, in the synaptic space. And then they go to this area here. And when that happens correctly, you get the proper propagation of, again, motor function, sensory or sense functions, thinking, mood, behavior, all that happens that way. So when you have those degenerative changes taking place in these synaptic areas, and you use L-carnitine, particularly when you take L-carnitine with omega-3 fatty acids. You want to make sure you get an omega-3 supplement that has no heavy metals in it and that's not oxidized. You can check out my omega-3 fatty acid on blooddetective.com and my amino acid complete formulation that has the L-carnitine in it. And I mentioned that salmon is one form of fish that has a very, very high omega-3 fatty acid content. The same with tuna and mackerel. And as I said, most salmon, however, you should be aware, most fish, no matter whether it's farm-raised fish or Alaskan, has heavy metals in it. So I always give my patient N-acetylcysteine, that's N-acetylcysteine or NAC, and that helps to remove metals from the body on a routine basis. And then they check their heavy metals from time to time to make sure that they're getting their omega-3s, but not also getting toxic effects of metals storing in their central nervous system, because what is that going to do? Those toxins cause neurodegeneration. Okay, we don't want that. You know what's really interesting about omega-3 and just fish consumption is that, you know, early hominids, early man and early human beings, I should say, those early hominids that lived by the ocean shores, they had much bigger brains and were a lot smarter than those who lived much more inland that did not eat fish. The omega-3 in the diets increased the size of the brain. So that's just a fascinating concept. We know, and we've known for a very long time, the essentiality of omega-3 fatty acids to promote positive neuroplastic regeneration. So here's a little bit more on omega-3 fatty acid supplementation. So what it says here is that long-chain omega-3 fatty acid supplementation accelerates nerve regeneration and prevents something known as neuropathic pain. Neuropathic pain is this deep, annoying, burning, unrelenting pain that people with all sorts of issues can have. It could be a spinal stenosis or multiple sclerosis, or diabetes, for example, and the right omega-3 fatty acids in the right dose, in the right patient, at the right time can make a huge difference. And it's very important, again, to use the L-carnitine with omega-3s because the L-carnitine takes the omega-3s, let's say that's omega-3s, and to put it in the brain, the L-carnitine acts like a carnitine car, to put it in the cells. So that's what we need. The right combination of nutrients is important. And I'll give you a whole list of them in a little bit. But what you must realize is that you may need some of these nutrients. You may need not all of them. And you may need certain of them at specific doses based on many other aspects of your health, many other considerations. And as far as exercise and brain health, listen to this. Effect of aerobic exercise on hippocampal volume. The hippocampus is just an area deep in the brain that controls many, many different functions, including personality and all kinds of other essential functions. Look at bullet number 1. The effect of aerobic exercise on improving the brain volume, because when brain volume goes down, that's bad. When brain volume goes up, that is good. And they used a meta-analysis here, the best way to do studies. And they found, when they looked at these studies very, very carefully, they did find that aerobic exercise did reduce shrinkage of the brain. Very important. Let's jump back to vegetables for a minute. First, a couple of basic things. Bullet number 1, oxidative stress, also known as inflammation, are 2 of the major triggers of what they call epigenetic alterations. So what happens is we live in this world, and for various reasons, due to poor diet, stress, electromagnetic radiation, toxins, we get changes in our genetic profile that can lead to degenerative changes in the brain. And polyphenols and other compounds, healthful compounds like resveratrol, found in vegetables and fruits can offset all of that damage. There's no guarantees, but the earlier you start these things, the better. So vegetables, herbs, and spices may exert relevant immunomodulatory, that means improving the immune system, and very strong anti-inflammatory effects in the aging brain. And then the last bullet here, it says that phytochemicals, phyto means plant, so plant chemicals act as positive modulators of neuroinflammatory events, which means they reduce inflammation in the brain. And this is about a high-fat diet, which is typical of the American diet, which is also known as the SAD diet. SAD, Standard American Diet, is SAD. And I can tell you that's true because, you know, as my education as a dietitian, I learned the Standard American Diet was good. And that, of course, is ridiculous. So high-fat diet induces hepatic, that means liver, insulin resistance, and impairment of synaptic plasticity. That means the more fat you eat, that tends to affect the liver in a negative way, specifically also even the pancreas and its production of insulin. And insulin, of course, we need for blood sugar balance. So look at this. High-fat diet-induced obesity is associated with insulin resistance, which may affect brain synaptic plasticity, meaning that the nerves, which should be flexible and working, they're stiff and they're hard and they do not work like healthy tissues. And then we have issues with learning, memory, and every aspect of nervous system function, again, depending on what areas or areas of the nervous system are affected. Let's talk now about what I call the blood detective approach. So for those of you who know me, because you've been listening to this show, you know I've been nicknamed the blood detective. And that's because apparently I'm pretty good at finding issues that sometimes practitioners miss. I think I do a pretty good job of putting different things together and looking and discovering connections. And that's not something general medicine does too well because of the compartmentalization of medicine. The neurologists don't talk to the gastroenterologists. The gastroenterologists don't learn nutrition. You'd think they talk to the dietitians, but no one talks to the dietitians. And then there's the toxicologists that have no friends and they don't go to parties. I'm joking a little bit here. There's no communication. And those of you out here listening to this, you probably know what I'm talking about. So the blood detective approach is an approach that I have invented that helps put things together. It compares your blood work to what they call clinical ranges and also to healthy or functional ranges. When you get a blood test done, your cholesterol, your glucose, your magnesium levels, your vitamin D levels, whatever it is, you're being compared to men or women that are in a certain age group that are apparently healthy, that walked into some clinic to give their blood and to donate blood. But they could have any number of problems, but they're only screened for anemia, AIDS, and maybe Ehrlichia, and that's about it. So it would make sense, I would think, what I call would make blood detective common sense, that you would doubt that those are the ideal ranges you want to be compared to. I certainly will not be comparing myself to other 55-year-old men. I do not want to look like them. I do not want to have their health. So why would I do the same things that they would do? So I want to compare my blood to healthy people. We'll talk about that more in a minute. And then based upon what your chemistry says when I compare you to the clinical ranges, the regular guys and gals, but also the healthy, plus my interview with you and our review of your health issues and your health goals. It's very important to know where you're going so we know how to shoot for that. I can figure out personalized food, exercise, lifestyle, and nutritional supplement recommendations. So let's get to that. So blood work tells you a lot. This is just a sample screen of, you can see on the left, it says glucose, hemoglobin A1C, and these other things here. Those are just the various blood tests you might get. And then there's the result column. And then there's how you compare in the center to the clinical or average people, okay? And then the H's and the L's there, that means high or low. And then if we go all the way to the right, we see more H's and L's. That's high or low when you compare your chemistry to healthy individuals. Now, if I compare your blood work to healthy people, I'm probably going to find more abnormalities there differently than if I compare you to just average people. But when I compare you to healthy, more may show up, but that's exactly the point. A different story that often uncovers a lot of hidden problems and natural solutions is there. So I produce these details report. Basically, I write a book on you that help figure this out. And this is just one of the tools I use, which is called my blood detective software, to quickly and accurately and nutritionally and medically interpret your tests. And then what I do is I take your chemistry and I divide it up, as you can see on the left here, into body systems. So these are like major body systems, you might say. Acid-base balance in the body, the cardiovascular system, the gastrointestinal system, as you can see, there's others. And then if you go to the right, you'll see clinical abnormalities and functional. And then you see all these numbers underneath. Let's just look at the functional, which is the healthy ranges. So for example, look at the cardiovascular system on the left. If you take that all the way to the right under functional, it'll say that there's 4 abnormal tests for this particular patient. So 4 abnormal tests that say that the cardiovascular system is the most obvious problem here. But when I would look at that test and read it from just a traditional medical perspective, it would only show 1 test. So that may not emphasize to me the importance of the cardiovascular system, so I would be losing out, or then again, my patient would be losing out by not having that emphasized. And if you look again, you'll see different numbers. There's many more abnormalities under the functional healthy, as I said, because if I compare it to healthy, you're going to have more abnormalities, but more is potentially revealed. Let's go to the next screen. So let's talk about some specific supplements again, okay? So my Amino Complete product is an amino acid formula. I mentioned carnitine earlier, which is very important to help improve neuroplasticity, particularly when it's taken with omega-3 fatty acids. It helps mental and physical function, hormonal problems, fat metabolism, nervous system issues, and muscular development. And then you can see here on the right, some of the ingredients in this particular product. These you can all find at blooddetective.com. And this is my one example of one of the 4 superfoods. So Superfood Orange Detox Formula 1. This is the one that I designed more specific for the nervous system, but they're all really for the rest of the body. But this is a little bit more directed towards the nervous system. The ingredients in it, and again, you can see some of these ingredients here. There's a lot more than this here. This is just a tiny little bit of it, are all mostly activated nutrients, which help in studies have shown to help cognitive dysfunction, nerve conduction, neurotransmitter production. We need those neurotransmitter chemicals so thoughts, feelings, and emotions happen. And I should emphasize to you right now that my specific products were not used in the studies, but my products used the studies for me to determine what nutritional supplements and compounds I put in my products. And then there's GABA, or gamma aminobutyric acid. This is really important. This is one of my favorite nutrients. It improves neuroplasticity. And all these nutrients I say improve neuroplasticity, they improve neuroplasticity. Many of them do it in some similar ways. And many of these nutrients work on neuroplasticity in different ways. So here are some of the other ingredients along with the GABA in this product. But GABA is a neurotransmitter. It's made in the brain. And it's a relaxing or parasympathetic neurotransmitter, which means tends to calm down hypersympathetic responses. It's used in traditional medicine as a prescription drug, gabapentin, for pain, depression, anxiety, and sleep, but not for neuroplasticity, which is, again, an unbelievable omission. These are just some of the other things that it helps, which I've actually just mentioned. And then there's DHEA. DHEA is dehydroepiandrosterone, and DHEA is an adrenal hormone. By about age 30, your DHEA levels are declining. And that means your adrenal glands are weakening. Medicine pays absolutely no attention to this, even though there's just incredible study on the potential health benefits in many areas of the body, including healthy aging overall, heart health, immune function, blood sugar regulation, weight management, bone health, and even managing estrogen and testosterone levels. But if you've had any estrogen-related cancer in the past, you do not want to go near DHEA. Although it's one of my favorite anti-aging nutrients, you might say, for neuroplasticity and to also produce lean mass on the body, because it is an anti-catabolic nutrient, which means it helps to slow down the breakdown of lean body mass. The more lean body mass breakdown you have, the worse your aging and the higher your disease risk. And we want to keep this brain glowing with health. And here's some other ways of doing it. We mentioned earlier ubiquinone, or activated CoQ10. It helps energy production in cells. When cells degenerate and they lose their neuroplastic effects, they lose cellular energy. CoQ10 improves cellular energy, and there's also inflammation and oxidative stress happening, breaking the brain down. And ubiquinol helps to counteract that. It helps produce ATP in the body, which is an energy molecule. Again, it's good for liver function, heart function, oxygen utilization, all extremely important things for the brain. You know, if you have cardiovascular disease, you might not have enough blood reaching your brain. That's why there's an increased risk of neurodegenerative problems in people with cardiovascular disease and pulmonary disease like lung disease. Even with renal failure, there's more toxins accumulating in the body, and they are neurotoxic to the brain. So all sorts of health problems that don't sound like nervous system problems can affect the nervous system. I hope I was clear about that. And then pregnenolone. Pregnenolone is similar to DHEA. Basically, it is a hormone, and pregnenolone helps to form many other hormones in the body. So cholesterol is up here, and cholesterol forms pregnenolone. Pregnenolone forms progesterone, which forms estrone, estradiol, and estriol, all the 3 estrogens. And then there's testosterone and DHEA forming from that. So depending on the patient, I might use this anti-catabolic hormone for either neuroplastic effects in the brain. It's been studied in traumatic brain injury, insomnia, adrenal fatigue. It improves mental clarity, anxiety, even depressed mood. Now, I don't mean to throw all these positives out there like they're guarantees, but I throw these out there because the studies are there. You don't have to believe me. You can go to the National Library of Medicine yourself, or the Cochrane database, and you can plug in these nutrients in there. And then relative to your condition or your brain or nervous system problems, and more studies will likely pop up than you'll ever be able to read in your lifetime. For example, the National Library of Medicine has over 3 million citations from 1966 into the present. So I am always on that doing research for my patients to personalize what they need. And I mentioned earlier the polyphenols. These are plant compounds that you will find in very high amounts in my superfood formula. You can see them here, formula 1, 2, 3, and 4. Again, there's scoopers in here. I usually have a patient take a half a scoop of each of these, mixed together all at one time, diluted in water to taste. But depending on the problem, I might go to a full scoop, even 2 full scoops. So each person, regarding all of these nutritional supplements and food choices and exercise, all of that must be personalized for the person, particularly if they have neurologic symptoms. You don't want to mess around trying to guess. So you want to really know what you're doing. And then Resveratrol, which I mentioned earlier. That's just one of many polyphenols, anti-inflammatories and immune modulators that help reduce the inflammatory effects in the brain and the oxidant effects and other bad chemicals that cause the brain to decay. And then vitamin D3, I talked about earlier, the dosing and how that's done right. Vitamin D is for so many things. We used to think it was just for bones, but now we know that virtually every tissue in the body, including the nervous system, has receptors. That means places where those chemicals, those neurotransmitters need to sit. But in vitamin D's case, every cell has a place to sit for vitamin D, which is why most physicians in just about every area of medicine now have some clue about vitamin D. Although most get the dosing wrong, and then they just drop their patients. They never ask them to come back and to be retested. And the patient thinks, well, my doctor said take this. When the bottle's done, I'm finished. Wrong. Okay. Now, in terms of supplementation and some things to think about, I mentioned the amino acid complex, and these are not doses I'm asking you to take. Remember, I gave you the disclaimer at the beginning of this presentation. I don't know you. I haven't looked at your labs. I can't possibly know what you actually need, but let's just talk about that for a little bit. So with the amino acid complex, the heavier you are, the higher your dose really of anything. And the more lean mass you have on you, which is muscle and organs, also the higher your necessary therapeutic dose probably is. If you pay attention to just the doses on bottles that some company figured out that don't know you, including the bottles that I produce from my blood detective supplements, which you'll find on blooddetective.com, I don't know you. So I have to put levels of nutrients on there which are somewhere in the minimum ranges of an effective dose, but they may not be the dose that you need. So one of the most important tests that I run on my patients is a bioimpedance test. And for those of you that have listened to Ask the Blood Detective shows before, you know I'm a big fan of bioimpedance testing. That's also known as a body comp test. That involves putting a current through the body. And when you do that, you don't feel the current, but the current goes through your muscle, your water, and fat tissue at different rates due to the density differences of those tests. And then the lean mass is separated out from the water and fat percentages. And based on that lean mass, I can figure out what I feel are the best doses for each person. Without that test, clinical nutritionists like myself are just flying in the dark. It's just a shot in the dark, and we can't afford to do that with problems as serious and significant as neurodegenerative changes. Now, there are other factors that go into dosing. For example, if you're over 50, you malabsorb. That means you do not absorb normally. So testing for how you absorb is a pretty reasonable thing. I don't know how many times I've sat before patients and they'll say to me, doc, I've been to 6, 7 different other practitioners. I haven't gotten helped. I'm not even sure why I'm here. And then I'll ask them, have you had a body comp test? No. Have you had your test for malabsorption performed? No, I don't think so. And these are people who will come to see me, and one of the first things they'll say is, by the way, Dr. Wald, I've had every test done you can imagine. And in my head, I'm like, oh boy, they're misled again. And besides, having a lot of tests is very different from having the right tests. If you don't know how you absorb and you don't know your body comp, how can you really effectively manage your nutrition? Maybe you might get lucky, but why get lucky when you can make the situation much more specific for you by knowing these factors? And whatever other health issues you have, maybe it's heart disease, maybe you're obese, whatever it is, arthritis, autoimmune disease, hypothyroid, all of these things matter because they consume nutrition. If you think you're going to just take, let's say, some of these things and it's going to go right to your brain when you've got heart disease or you've got lung problems or joint problems, everything gets sort of diluted out. So a good practitioner is going to give you quite a thorough interview regarding your entire metabolic profile, so we can find out what it is you actually need for your general health and well-being. Then if you have neurodegenerative issues, remember those are issues that affect the brain and degeneration, then those are built on top of the base. Does that make sense? Okay. And then also initially, dosing might not be 100%. It never is. So there's some amount of trial and error, at least when I recommend supplements initially, that need to be adjusted over time. I've had patients say, yeah, Dr. Well, I've been taking all your nutrients. I know I haven't seen you in a couple of months. I've been feeling good. I decided to train for a marathon. And I'm thinking, oh boy, that stress of marathon training is a wonderful thing. I mean, I run marathons too, but that sucks nutrition away. Many people just don't seem to understand that everything matters in terms of what they do and what they do not do to figure out supplementation. I want to make sure that my patients have the correct supplements, the minimum amount necessary, focusing on the diet as much as possible. But with neuroplasticity problems, right? We understand that word now. In my opinion, you cannot do it with diet alone. No way, not going to happen. So amino acids, because they help make neurotransmitters. 80% of the neurotransmitters in your brain are gotten from the diet. But if you don't absorb that diet right, that's going to be a problem, right? Because you're not what you eat. You're what you absorb from what you eat. And then the superfoods, the second column on the left, superfoods 1, 2, 3, and 4, which I mentioned earlier. They are loaded with polyphenols. And then there's GABA, gamma-aminobutyric acid, which is a neurorelaxing, you might say, neurotransmitter, proven to help various aspects of neuroplasticity. DHEA, that adrenal hormone, that's another very important hormone, along with pregnenolone in the upper right corner up here, that have been shown to offset shrinking of the brain by reducing inflammation of the brain and supporting the neuronal pathways. Those are the wires in the brain, right? I think we're getting it now. That's great. And then we want a multivitamin, not just any multivitamin. Do not take a multivitamin that has iron in it unless you're anemic and you know why you're anemic. Too much iron is dangerous, can increase your risk of cardiovascular disease, can increase your risk of cancer. But if you are anemic, that's a problem. So you want a multivitamin with or without iron, depending on your needs, and all the ingredients, or most of those ingredients in the multi, need to be activated, because you don't want your body having to activate things if you can get them activated before you take them. It's less work on the body. Activated, activated, activated. Then there's omega-3 fatty acids. Very important, because most of the brain is made of omega-3 fatty acids. So when you age, if you can get more omega-3 fatty acids in you, not only will those fatty acids go into fat tissue, helping to burn fat much more easily, but they get into the brain because it's fatty, and omega-3 fatty acids are fat soluble, just like vitamin D is, and lipoic acid, and DHEA, and pregnenolone. And they get in the brain and they support the brain structure in different and often complementary ways. Ubiquinol, that increases the mitochondria in the brain, which produces energy in the brain, so there's more energy to repair things. And then I mentioned resveratrol, and of course, vitamin D. I didn't mention zinc, but zinc is the most abundant mineral in the hippocampal area of the brain, a major area which relates to many other areas of the brain. and then turmeric. I can't emphasize that enough, but it's not all the same. You need to have it with black pepper fruit. You should determine the dose based on body composition. And last but not least, superbugs or probiotics. Mine is designed to help reduce health problems in the gut, but a lot of inflammatory chemicals form in the gut. They get into the bloodstream and they circulate in the brain. Whoa, that was a lot. So we're going to end by, first of all, me saying thank you and offering you a free 15-minute consultation on the phone with me. You can email me if you desire to have that consultation. Please don't call me for that. Email me at info@blooddetective.com. If you know you want to schedule with me as a patient, please call me directly. I'll likely be the one that picks up the phone. I screen all of my patients. My number is 914-552-1442. And again, my website is either intmedny.com or drmichaelwall.com. And last but not least, my email is my website for the nutritional supplements is blooddetective.com, and you'll find all of the detailed information on all of those products. So thank you all so much for joining me today, and I'll see you next time for the next installment of Ask the Blood Detective. Take care.